Hello there. My name is Pharmacist Michael, and today we're going to talk about Raloxifene, or Evista, which is a selective estrogen receptor modulator. This medication has gained significant attention in the field of women's health and osteoporosis management. Evista has a unique pharmacological profile, as well as clinical efficacy. This makes it a valuable therapeutic option for postmenopausal women who are at risk of osteoporosis and certain other estrogen-responsive conditions. In this video, I'm going to talk about Raloxifene's pharmacology, its therapeutic uses, side effects, drug interactions, and future directions in research and clinical practice. So how does Raloxifene work? Well, it selectively binds to estrogen receptors and causes both agonistic and antagonistic effects, depending on the target tissue. When it comes to bone, Raloxifene acts as an estrogen receptor agonist. This helps to stimulate bone formation and inhibits bone resorption, reducing the risk of osteoporotic fractures. In contrast, in breast and uterine tissue, Raloxifene acts as an estrogen receptor antagonist, which decreases the risk of breast cancer and endometrial hyperplasia. Raloxifene currently is used primarily for the prevention and treatment of osteoporosis in postmenopausal women. We know that it increases bone mineral density and reduces the risk of vertebral fractures. But this drug is also approved for the reduction of invasive breast cancer risk in postmenopausal women with osteoporosis or those at high risk of breast cancer. Raloxifene has also been investigated for its potential benefits in other estrogen-responsive conditions like cardiovascular disease and cognitive function. But further research is needed to determine its role in these areas. Raloxifene does have the potential to interact with other medications, which can affect its pharmacokinetics and pharmacodynamics. When Raloxifene is used with other drugs that are inhibitors or inducers of cytochrome P450 enzymes, its metabolism and serum concentration may be altered. Also, drugs that increase the risk of embolism, such as hormonal contraceptives and hormonal replacement therapy, may potentiate the thromboembolic effects of Raloxifene. It is important that healthcare providers carefully evaluate the risks and benefits of co-administering Raloxifene with other medications and adjust dosages accordingly to minimize the risks of adverse reactions. Research is still being done on Raloxifene, as we are still trying to discover its mechanisms of action, optimize its therapeutic efficacy, and minimize adverse effects. Future studies may focus on identifying subpopulations of postmenopausal women who are more likely to benefit from Raloxifene therapy based on individual risk factors and genetic predisposition. There is also growing interest in exploring the potential use of Raloxifene in combination with other agents for the prevention and treatment of osteoporosis and other estrogen-responsive conditions. By advancing our understanding of Raloxifene, we can optimize its clinical utility and improve patient outcomes in women's health as well as bone health. If you have any questions about Raloxifene or any other drug or nutritional supplement, please leave them in the comments section. Also, be sure to check out the description section of this video, where I have placed several links to products I recommend to help you live a happier, healthier life. These are products that I actually use myself. Also, if you want to be a happier, healthier person, be sure to subscribe to our channel. We release 3 new videos each week. I hope you've enjoyed this video, and thank you so much for watching. My name is Pharmacist Michael. Be happy and be healthy.